It is considered a stomach bacterium Helicobacter pylori, H. pylori, pylori, or twisted H. pylori, or what is also known as H. pylori, or digestive H. pylori, are gram-negative bacteria, which live and multiply in the walls lining the stomach. Helicobacter pylori is one of the main causes of inflammation in the stomach and duodenum. Pylori was discovered by two Australian researchers who also found that it causes peptic ulcers. H. pylori is one of the causes of ulcers, and not the other way around, and a person remains infected with it unless he receives appropriate treatment. Although the causes of H. pylori are not yet known, there are a number of ways available to treat it and alleviate its symptoms. The causes of H. pylori, or H. pylori, are still unknown until now, but the infection may spread, and a person becomes infected by the following: water or drinks, contaminated food or contaminated dinnerware. Many people wonder, is the stomach germ contagious? The answer is yes. One of the causes of H. pylori is its transmission from person to person. Pylori or H. pylori can be transmitted from person to person in the following ways: saliva diarrhea, fecal contamination in food or water, and this may occur with poor hygiene practices and not washing hands thoroughly after using the bathroom. Pylori is more common in overcrowded communities, such as large families, especially in developing countries that lack clean water or good sanitation networks. Although some people infected with this bacterium do not show any symptoms, there are other people who show symptoms of H. pylori, which may vary depending on the severity of the infection. The following are the symptoms of H. pylori: burping, bloating in the abdomen, nausea and vomiting, discomfort in the abdomen. It is worth mentioning that the symptoms of H. pylori often increase when the stomach is empty, such as between meals or in the middle of the night. Symptoms of H. pylori can last for a few minutes or hours, and the patient may feel better after eating, drinking milk, or taking antacids. In cases of chronic and severe infection from H. pylori, the symptoms may be more severe, and sufferers may experience signs and symptoms of stomach ulcers, duodenal ulcers, or severe gastritis. Such symptoms include the following: abdominal pain, nausea, vomiting, which may include the presence of blood, blackening in the color of feces, fatigue and exhaustion, anemia, and a decrease in the number of red blood cells due to bleeding stomach ulcers, loss of appetite, diarrhea, stomach ulcer, heartburn, bad breath, losing weight for no apparent reason. A severe H. pylori infection of the stomach can cause intestinal bleeding due to the severity of ulcers in the stomach or intestines, which is considered dangerous. It is advisable to seek medical help immediately if the following symptoms are observed: the color of the stool changes to a dark black color, or the presence of blood in the stool is noticed; feeling of difficulty breathing, feeling dizzy; severe fatigue for no reason; pallor of skin color; vomiting accompanied by blood; severe and sharp pains in the stomach. It is also worth mentioning that Helicobacter pylori infection can cause stomach cancer, but this is not so common. Symptoms that can initially indicate this disease include acidity in the stomach, nausea, lack of hunger, or a feeling of fullness of the stomach after a small amount of food, vomiting, unintentional weight loss. Pylori infection is considered contagious, but many people live with these bacteria in their bodies without showing any symptoms. In the absence of any symptoms of the presence of stomach ulcers, it is likely that the person will not need or be asked to examine the stomach germ. But if a person suffers from some symptoms indicative of H. pylori, or the person has previously suffered from H. pylori, it is better to take a test and confirm the activity or absence of infection. Excessive intake of medications used to treat ulcers, such as non-steroidal anti-inflammatory drugs, NSAIDs, can also damage the stomach lining. Therefore, it is important to know the causes that produce the pathological symptoms that a person complains about so that appropriate treatment can be obtained. The following are the methods for diagnosing Helicobacter pylori. Pathological history. Clinical examination for the diagnosis of H. pylori. Diagnostic examinations and tests for the diagnosis of H. pylori. A blood test to detect stomach germ. Stool test to detect stomach germ. A breath test to detect stomach germ. Biopsy to detect stomach germ. Endoscopy for the detection of stomach germ. Radiography for the diagnosis of H. pylori. Initially, the doctor takes the patient's medical history and asks about the symptoms he is experiencing, and when they begin to appear, in addition to asking about any medications or dietary supplements that the patient is taking. After obtaining the patient's medical history and hearing the pathological symptoms, the doctor proceeds to a physical examination of the patient, which includes pressure on the abdomen to make sure there is any bloating or pain, in addition to hearing any sounds that may be coming from the stomach as well. The doctor may order one of the following tests or radiographs to confirm the presence of bacteria, including a blood test to detect stomach germ. A blood sample is taken from a vein in the arm of the hand, and then sent to the laboratory for analysis, which will be used to search for antibodies, which are proteins that the human body's immune system synthesizes when it detects the presence of harmful bodies such as bacteria, as these antibodies attack foreign organisms, such as Helicobacter pylori. But it is worth noting that this examination only tells the diagnosing doctor whether the patient's body contains antibodies to bacteria or not. So it is not possible to know if there is a current infection, or how long the patient has been infected with it, because the test can be positive for years, even if the infection is treated as the antibodies remain in the blood. As a result, it is not possible to rely on this examination to find out whether the infection has been treated. Stool test to detect stomach germ. The H. pylori of the stomach is examined by stool by preparing a stool sample, where the patient is given a special sterile canister to prepare a stool sample, and then sent to the laboratory to determine the presence of Helicobacter pylori in the stool. This test usually requires stopping taking some types of medications before the exam, such as antibiotics and proton pump inhibitors. This test can be used to diagnose an existing infection with a bacteria that cause H. pylori, and in order to make sure that the infection has been completely cured after receiving treatment. A breath test, or what is known as a breath test for a carbon, or urea isotope urea breath test, or UT, is performed by swallowing a patient of a special substance containing urea. In the case of the presence of Helicobacter pylori bacteria, these bacteria convert urea into carbon dioxide, which is collected in a special device and tracked during the exhalation process after 10 minutes. Urea is a substance produced by the body as a result of protein breakdown, and the urea used in this test is synthesized in the laboratory in a harmless way. This test can diagnose all people infected with this bacterium, and can also be used to verify that an infection that has received previous treatment has been completely cured. Also, up to 2 weeks before this test, the patient should stop taking antibiotics, bismuth medicines, and proton pump inhibitors. A sample or biopsy of the tissues forming the stomach lining is taken through an endoscopic operation, which is performed in a hospital or outpatient clinic. This method of diagnosis is the most accurate way to find out if a person has a Helicobacter pylori infection. A biopsy is usually taken during an endoscopy for reasons other than diagnosing a stomach germ. These reasons include diagnosing an ulcer, the presence of bleeding in the stomach, or making sure that there is no stomach cancer. In the process of gastric endoscopy, the doctor inserts a long and thin instrument called an endoscope, starting from the mouth down to the bottom of the stomach and duodenum. The attached camera sends images on the connected monitor to show to the doctor to notice any changes in tissues or abnormal areas, and record observations to help with the diagnosis. And, in some cases, if necessary, the special instruments used with the endoscope will allow the doctor to take samples of the tissues of these areas. For radiographic imaging tests to diagnose Helicobacter pylori infection, they may include imaging of the upper gastrointestinal tract. This procedure is performed in the hospital where the patient is given a liquid containing a substance called barium. Then an X-ray image is performed, and barium is a substance that contributes to making the image of the throat and abdomen clearer. Computed tomography, which is a powerful X-ray that produces detailed images of the interior of the body. How is the diagnosis of H. pylori treatment of stomach germ? Although the causes of H. pylori are not known yet, H. pylori is treated with a range of medications, and for a period of 14 days, mostly, but the period may be prolonged depending on the case and on the recommendation of a doctor. Drug therapy options used in the treatment of Helicobacter pylori include antibiotics. Antibiotics work to kill bacteria, including amoxicillin, clarithromycin, levofloxacin, rifabuxin, rifabutine, tetracycline, metronidazole, proton pump inhibitors. They are drugs that reduce stomach acidity. Bismuth subsalicylate. Bismuth has the effect of enveloping ulcers and protecting them from stomach acid. It is usually difficult to eradicate, remove, and completely heal H. pylori bacteria. This is because they are able to develop resistance against commonly used antibiotics, so 2 or more antibiotics are often administered along with one of the proton pump inhibitors, bismuth subsalicylate, as reducing stomach acid helps antibiotics to work more effectively. After the end of the treatment period, the patient will usually need to undergo tests to make sure that the crooked bacteria have been completely eliminated. Some patients may need to repeat the treatment again, either with the same combination of drugs used earlier, changing one of the drugs, or adding a new drug to the used one. The pharmacological regimens used to treat H. pylori include triple treatment of stomach germ. Triple treatment of H. pylori is the most common in getting rid of H. pylori completely, and one of the following groups of drugs is taken orally, so that the duration of H. pylori treatment using this system is from 10 to 14 days. The names of the spiral microbe therapy drugs used in this system include omeprazole at a concentration of 20 mg twice a day, amoxicillin at a concentration of 1 g twice a day, amoxicillin at a concentration of 500 mg twice a day. Bismuth subsalicylate at a concentration of 525 mg 4 times a day, metronidazole at a concentration of 250 mg 4 times a day, tetracycline at a concentration of 500 mg 4 times a day. Lansoprazole at a concentration of 30 mg twice a day, amoxicillin at a concentration of 1 g twice a day, clarithromycin at a concentration of 500 mg twice a day. Recovery rates from H. pylori are estimated to be between 70–90% of cases of total infection with H. pylori. However, a type of spiral microbe has been observed that is resistant to some antibiotics used, especially clarithromycin and amoxicillin. In this case, triple therapy is used, which includes levofloxacin or rifabutine, along with amoxicillin and isomeprazole, where the cure rates can reach 90% and 88.6%, respectively. Treatment of Helicobacter pylori tetralogy is the best initial treatment in areas where the rate of clarithromycin resistance is greater than 15%, as is the case in many regions of the developed world. Quadruple therapy involves taking a proton pump inhibitor, such as omeprazole, at a concentration of 20 mg, or lansoprazole, at a concentration of 30 mg, twice a day, metronidazole, at a concentration of 250 mg, 4 times a day, tetracycline, at a concentration of 520 mg. As in adults, doctors use antibiotics in the treatment of the spiral microbe in children, and one antibiotic may not kill H. pylori bacteria, so doctors often prescribe a combination of antibiotics. And to relieve stomach acid problems, doctors will usually also give antacids or acid-inhibiting drugs. Antibiotic therapy contributes to the prevention of many cases of gastritis and peptic ulcer diseases caused by Helicobacter pylori bacteria, especially duodenal ulcers. A child with symptoms of bleeding from the stomach or small intestine is treated in a hospital. Approximately 50% of patients experience side effects while taking Helix microbe therapy, and these effects are usually mild that do not require stopping treatment. Only less than 10% of patients discontinue treatment due to side effects, and adjustments in the dose or timing of taking medications may help alleviate side effects. Side effects of H. pylori treatment include nausea and vomiting, diarrhea and abdominal cramps, a headache. Untreated infection with Helicobacter pylori may lead to a number of complications, which may include the occurrence of stomach ulcers, the occurrence of internal bleeding in the stomach, anemia or low blood pressure as a result of bleeding, the incidence of stomach cancer in some individuals. In addition to following the doctor's instructions, there are a number of tips that help alleviate the symptoms of stomach germ infection, or contribute to its faster treatment, along with drug treatments. Avoid foods that aggravate the symptoms of stomach germ infection, especially spicy foods. You should quit smoking. It is preferable to divide meals at intervals of the day, so that they are close, in order to avoid complete emptying of the stomach and its high acidity. Alcohol intake should be stopped. You should drink appropriate amounts of water, just 6 glasses a day, unless there is any medical contraindication to this.